All right, in this lesson, we're going to talk about glaucoma. Glaucoma, by definition, is damage to the optic nerve as a result of increased pressure inside the eye. And we refer to this pressure as intraocular pressure, or IOP. In order to understand how that works, we have to take a few steps back and take a look at some anatomy of the eye. So here you see the cornea, the iris, the lens, and back here you've got your optic nerve. Now, the anatomy of the eye functions similarly to a kitchen sink. The iris has some cells back here called ciliary bodies. And what they do is they produce the fluid in the front portion of the eye called aqueous humor. And when we talk about flow in the eye, the aqueous humor comes down here and fills the front portion of the eye. Much like a sink, the ciliary bodies produce the fluid like the faucet. Much like the sink, there is a drain. In the eye, the drain is here at the corner of the iris and the cornea. What happens in glaucoma is that the drain becomes clogged, therefore overfilling. And the way that works in the eye is because the eye is a confined space, the fluid has nowhere to go, therefore the pressure in the eye goes up. The problem with glaucoma is that this pressure comes back and puts pressure directly on the optic nerve, causing damage to the optic nerve and therefore decreasing vision. Now that we have a better understanding of glaucoma, we're going to look at different types of glaucoma. There are two different types of chronic glaucoma, open angle and narrow angle. Let's draw your So here is your drainage angle. In open angle glaucoma, the angle is open, but over time becomes clogged, causing an increase in pressure. With narrow angle glaucoma, you have a problem with the anatomical structure of the iris where this opening is narrowed, also increasing pressure. The one that we worry about the most is acute angle closure glaucoma. Because of things like trauma or infection or inflammation, this becomes completely blocked. This in turn increases pressure in the eye. And the problem with this is it's actually a medical emergency. If we don't fix this problem quickly, the patient could lose vision long term. The last type that we look at is normal tension glaucoma, where the pressure inside the eye is actually normal, but the changes and damage to the optic nerve are consistent with other types of glaucoma. Now we're going to take a look at some assessment findings. Things that your patient will talk about are vision loss or vision changes. This is because there has been damage to the optic nerve. They may also complain of eye pain or headaches. This is because there's an increase in the intraocular pressure. Things that you'll see as your nurse are corneal changes like a hazy or cloudy cornea, or some scleral changes where the whites of the eye actually look bloodshot. So if you look at this picture over here, you see that here's the edge of the cornea, and this area in here is actually cloudy, and the eye is bloodshot. Now, the important thing to remember about bloodshot eyes are they're not an isolated symptom of glaucoma. They do not always equal glaucoma. If you have a patient that's complaining of vision loss, eye pain, headache, you notice some corneal changes and some scleral changes, you can suspect that glaucoma may be the culprit. The way that we will actually differentiate that is by using some diagnostic tools like tonometry. Tonometry is a fancy word for a measurement of the pressure. The thing that you need to know is that the measurement is normally 10 to 21 millimeters of mercury. When we talk about medications, we want to think back to how the eye works like a kitchen sink. So we have different types of medications. some medications work to decrease the outflow, and we focus on unclogging the drain here. Now, other types of medications decrease fluid production. So this is like turning down the faucet. The reason we want to do this is because it decreases the amount of fluid in the eye and decreases that pressure. Now, the last type of medication there are some medications that do both. And what we want to do here is we can actually unclog the drain and turn down the faucet. So if you'll notice, there are some medication classes here and some medication examples. Just refer back to your resources here in this lesson so that you can get a better understanding of those. When we talk about nursing priorities, there are some situations we want to avoid. These are things like placing your patient in Trendelenburg, having your patient perform the Valsalva maneuver, or from bearing down, like patients that have constipation. The reason that we want to do this is all of these things increase intracranial pressure. So pressure inside the head. What happens when you have an increase in intracranial pressure? This increases the intraocular pressure. So you just need to be mindful that when you have a patient that has glaucoma, and anytime you're intervening, you want to think about their eye pressure. For example, if you have a patient who couldn't be turned and they have to lay flat and they're constipated, that could actually be problematic for their glaucoma. When it comes to educating the patient, we have two main focuses. The first one is on medication, and the second one is on activities of daily living. Now, when it comes to medication, it's important for your patient to understand how to properly give themselves medication. More importantly is medication compliance. Non-compliance in patients with glaucoma equals worsening or uncontrolled glaucoma. So when you're educating your patients, make sure that they understand the importance of maintaining their medications. When we talk about activities of daily living, the biggest takeaway is safety. Your patient at any time could have limited vision loss or their vision could go. So you want to make sure that they have things like handbars in their house. You want to make sure they get rid of throw rugs. You want to have them keep their furniture where it's at because you don't want them to trip. If you have the opportunity to do a safety assessment in your house, that's a big advocate for your patient. Additionally, you can look at ways for your patients to have easier time seeing. So large text telephones, those things can help improve their activities of daily living at home. Quickly, cover some nursing concepts with you guys. Safety is important because you need to make sure that your patient is safe at home because they now have decreased sensory perception and vision. Also, you want to be mindful that your patient can sometimes be uncomfortable with glaucoma. All right, now quick recap. Remember, glaucoma is about the increased pressure inside the eye. Increasing that pressure can cause vision changes, vision loss, and retinal damage. The eye is like a kitchen sink. So if you have increased pressure, you need to unclog that drain. Remember, medications can turn down the faucet, unclog the sink, or you can do both. As a nurse, you need to make sure that you are being mindful of interventions that can increase pressure inside the head or the eye. And lastly, with patient education, you want to make sure that they're staying compliant with their medications so that they can have long-term success with their glaucoma. So that's it for glaucoma, and make sure you check out all the resources attached to this lesson. And as always, now go out and be your best self today. Happy nursing.